We waited a week to do this segment. It's only fair to give the CDC some time. Last Wednesday, they admitted massive failures during the pandemic. Of course, 1 million plus Americans died during the pandemic, ruined and changed our lives for years. You'd think we'd want to get to the bottom of all of the problems of the pandemic. A Blue Ribbon Commission, 9/11 style commission, January 6th committee style investigation, so we can fix all of the problems. Faye Flam is here, Bloomberg opinion scientist, columnist, and science journalist. Faye, it's good to see you. Do you feel like when the CDC admitted these failures, there's really a good faith desire to truly answer the hard questions?
Well, one thing I wish they had done was to tell us more specifically what those failures are, because I think a lot of Americans assumed either it was that they were somehow too lenient and didn't recommend enough restrictions and therefore were responsible for excess deaths. And then I think there are other people that are a lot more outraged about all of the restrictions that didn't really help. So they were a little vague about what their mistakes were.
Well, right. If you can't admit what your mistakes were, you can't fix them, which is why you want independent people to look at them. This graphic we put together of what their internal review might have looked like as they thought they were going to do an internal look at things. It was basically 4 people from the agency and 1 guy from Health and Human Services. They could have also called that happy hour as they sat around and talked about things after work. It's an admission of a problem without any desire to have a solution, or am I wrong?
Well, it's a start, but I think, to back up, we need to think about what their specific role is, because there were so many people that failed us during the pandemic, and it's easy to sort of mix up CDC's failures with the public health community at large, with our politicians and their failures. And, CDC really, what they have traditionally been good at is doing science and getting us solid, nonpartisan data so that we at least can agree on what we know from science, and then we can have some of the discussions that we need to have about our values, about how much we value safety versus how much we value freedom. But we've been arguing without that sort of solid data that I think people had
There was a lot of data they withheld. There's issues still with whether or not they're giving all the data. You think about now with polio, they're withholding testing data for private groups who want to do testing on polio as it's resurging. You think about monkeypox, on and on and on. But I get back to this idea. And look, give them credit. They at least admitted that there were failures. Dr. Fauci refuses to admit that. The FDA refuses to admit that. And it's not partisan. The Trump administration had clearly had some real issues themselves during COVID. All the more reason. 9/11, TWA Flight 800, assassination of JFK, all of these things had this big commission that looked at it and did the examination that's so difficult. Why is there such a reluctance to do that in this case?
I think it's just because they're not finished yet. The pandemic and the problems and the things that are going wrong are still going wrong, and I think that people are just we're finally sort of stepping back from the acute phase of the pandemic and looking at why things went so badly. There were so many different little missteps, and I think they've added up to something where, people are wondering, where was CDC? Why are they giving us, decrees without good data and studies to back it up, whether it's changing how long people are supposed to be isolating after they test positive, to bringing in new mask mandates, taking away mask mandates. Where are the data on masks? We have very little data on all these non-pharmaceutical interventions.
No, you make a great point. We throughout all of this, they said they want to get better, but they still haven't released the data for us to figure out whether what they said worked or didn't work. Hey, Faye, we appreciate it. Your piece in Bloomberg was awesome. Monkeypox coming, polio coming. You got a lot to write about. We appreciate it. Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.